You are trying to lift a cup of coffee, type on your keyboard, or grip a steering wheel, and a sharp, burning agony shoots directly through the outside of your elbow and down your forearm. You go to a local doctor, they press on your elbow, and they instantly diagnose you with lateral epicondylitis, commonly known as tennis elbow. For the next year, your life revolves around fixing this arm. You wear a tight, heavy brace around your forearm every single day. You undergo agonizing deep tissue massage. You spend thousands of euros on shockwave therapy, platelet-rich plasma, and multiple cortisone injections directly into the elbow joint. But the terrifying reality is that nothing works. The heavy, burning pain never stops, and your grip strength is getting progressively weaker. If you are trapped in this cycle of failure, you must immediately stop treating your arm. You are the victim of a massive medical misdiagnosis. Your elbow tendon might be perfectly healthy. You are suffering from a crushed spinal nerve. And today, we will explain exactly why your doctor is treating the wrong half of your body. To understand why your elbow is on fire when the actual mechanical failure is inside your neck, you must understand the complex electrical wiring of the human nervous system. Think of your spinal cord as the main electrical breaker box for your entire physical structure. The nerves that exit this box travel down your limbs and act as the electrical cables that provide power and sensation to your muscles. In your cervical spine, which is your neck, there is a massive network of electrical cables called the brachial plexus. We must focus intensely on two specific cables, the C5 and C6 nerve roots. These nerves exit the spine in the middle of your neck, travel through your shoulder, run straight down the outside of your arm, and plug directly into your elbow and your forearm. If a mechanical failure in your neck, like a collapsed disc or a sharp bone spur, crushes the C5 or C6 nerve root, the brain receives a chaotic, high-voltage distress signal. Because that specific electrical wire travels directly through the outside of the elbow, your brain assumes the elbow tendon is being destroyed. The pain is absolutely real, but it is referred neurological pain. The appliance is perfectly fine. The short circuit is happening inside the breaker box in your neck. This anatomical overlap exposes why traditional arm treatments completely fail for this condition. When a local orthopedic doctor or physical therapist assumes you have a failing elbow tendon, they focus entirely on the local tissue. They inject highly powerful synthetic steroids directly into the elbow to stop local inflammation. They prescribe aggressive scraping techniques to try and heal the tendon. Some patients even undergo totally unnecessary open elbow surgery to cut and release the tendon tissue. If the pain is actually a false alarm generated by a crushed C6 nerve in your cervical spine, these elbow treatments are a catastrophic waste of biology. You cannot fix a crushed electrical wire in the ceiling by injecting chemicals into the light bulb on the wall. Injecting multiple rounds of steroids into a healthy elbow will only degrade your natural tendons and destroy healthy cartilage. Furthermore, violently massaging or scraping your forearm will do absolutely nothing to relieve the heavy, physical bone pressure that is actively suffocating the nerve cable high up in your neck. We cannot solve this mystery by guessing or staring at a useless elbow X-ray. We must act as elite medical detectives to definitively differentiate between true tennis elbow and cervical nerve compression. There is a highly specific, undeniable clinical pattern we look for. True tennis elbow is a mechanical problem. It usually hurts only when you perform a specific mechanical action, like tightly gripping a heavy object or bending your wrist backward against resistance. When your arm is completely at rest, the elbow usually stops hurting. If your elbow pain is caused by a spinal nerve, the pattern changes completely. Nerve pain does not care if you are gripping an object. A crushed nerve often burns and aches even when your arm is completely resting by your side. The pain often radiates upward into the shoulder blade or up into the base of the skull. The most critical clue is sensory loss. The C6 nerve controls the sensation in your thumb and your index finger. If your elbow hurts and you also notice a strange tingling numbness creeping into your thumb, the elbow is not the problem. Your cervical nerve is dying. When an elite neurosurgeon sees these combined symptoms, we immediately abandon the arm and order a high-definition magnetic resonance imaging scan of the cervical spine. When we evaluate the cervical MRI, we focus intensely on the middle segments of the neck, specifically the C4-C5 levels and C5-C6 levels. We look at the axial, top-down view to measure the exact millimeter of clearance around the exiting nerve roots. We must determine the exact nature of the mechanical clamp inside the nerve tunnel. Is the thick, rubbery wall of the spinal disc bulging outward and suffocating the nerve? Has the disc completely ruptured, allowing a fragment of highly toxic, inflammatory gel to leak out and chemically burn the nerve root? Or has severe arthritis caused hard, calcified bone spurs to grow and choke the tunnel closed? We map the exact millimeter of the compression. If the MRI shows a crushed C6 nerve on the right side of your neck and you have burning pain and weakness in your right elbow and thumb, we have a perfect mechanical match. The true diagnosis is confirmed. Because the elbow pain is simply a false alarm caused by the neck, our entire treatment protocol is focused exclusively on releasing the pressure inside the cervical spine. If the MRI proves that the compression is caused by a contained soft disc bulge, we avoid massive open surgery entirely. We utilize ultra-minimally invasive techniques like percutaneous laser decompression. Under local anesthesia, we guide a microscopic laser fiber directly into the failing cervical disc. We vaporize a tiny fraction of the internal pressure, creating a vacuum that physically pulls the bulge away from the nerve root. If the compression is caused by a massive ruptured disc fragment or hard arthritic bone spurs, the laser is obsolete. We use advanced microscopic surgery. Through a tiny, precise incision, we use high-definition visualization to gently shave away the overgrown bone spurs from the inside out, or we remove the shattered disc and stabilize the spine. We physically free the electrical cable. The moment the nerve is released, normal blood flow returns. The false electrical signals stop, your grip strength returns, and the terrifying stabbing pain in your elbow permanently vanishes. Many patients live with severe burning arm pain for years. They accept the agonizing daily routine because they trust a doctor who never bothered to look at their neck. They spend thousands of euros on custom elbow braces, painful shockwave therapy, and repeated steroid injections that slowly destroy their healthy arm joints. But let us look at the true cost of getting this wrong. If you ignore a severely crushed nerve in your cervical spine, it will eventually suffer irreversible damage. The nerve will die from oxygen starvation. You will permanently lose the strength in your hand. Your arm will constantly ache, and the numbness will become permanent. You are risking lifelong neurological damage and unnecessary arm surgeries because your doctor is treating the wrong anatomy. For a fraction of the cost of useless elbow treatments, you can have an elite neurosurgeon review your spinal imaging, potentially saving your nerve and ending the pain immediately. If this video helped you understand your pain, please click subscribe. It allows us to keep providing free, elite medical education to patients worldwide who cannot afford a neurosurgeon. You are watching this video because you are looking for a real solution to your pain. But you cannot fix a mechanical spinal problem by guessing, and you cannot fix it by asking questions in a comment section. If you have been treating your arm for months with zero relief, do not just accept the pain. Every spine is unique. Click the link in the description to upload your MRI or CT scans to our secure portal. Our neurosurgeons will personally review your imaging, trace your pain back to the exact source in your neck, and build your personalized treatment plan. Stop living in pain and stop treating the wrong joint. Let us find your true solution today.